In oncology trials, for instance, if you see the evolution of oncology trials from 2000 to 2019, with the green shaded being used using biomarkers in oncology trials versus non-biomarkers, you'll see that it's about a 4-to-1 split back in 2000. And now approximately 60% of oncology trials are using some element of biomarkers. Why are they important? Well, the clinical success rate using pre-selection biomarkers is very important. If you look at a publication that shows the phase-to-phase transition of drugs for phase 1 to phase 2 to phase 3, 3 to NDA to approval of using pre-selection biomarkers and the dark purple versus no biomarkers, you'll see overall on phase 1 to 2 is pretty similar. Phase 3 to NDA, or BLA approval, it's a little bit greater, but this is the biggest difference. Phase 2 to phase 3, this is where you have safety and efficacy trials, and also these are your inflection points for going forward. It's nearly 40 to 50% higher. If you do it overall from phase 1 to LOA, the difference may not be great, but it's 7.6% without a biomarker and 16% with a pre-selection biomarker. Or you have a 2 times a greater success rate using pre-selection biomarkers versus not. Here's a downside, a case study. In the supplemental materials, this is entitled Tumor Mutational Burden, and I've shown you sort of the science article as well as the actual article itself. So let's just kind of go through it because it does require a little bit of detail. So sequencing of tumor DNA is now a routine part of cancer. Identifying specific mutations can help physicians narrow down sort of the best treatment. Clinical trials have shown that mutations within tumors, which are entitled sort of high tumor mutational burden, responds well to drugs known as immune checkpoint inhibitors. You may have heard of them, Keytruda, which enabled them to attack tumors. Well, a study in 2021 found that a high TMB could predict whether patients could respond to certain types of checkpoint inhibitors like Keytruda. Just a few months later, the FDA approved the drug for the treatment of tumors with high TMB, which are found in some lung cancers, melanoma, and cervical cancer. Great.